More than 6 months after it was revealed Darwin's 2 adult mental health wards were running at capacity, with new patients regularly made to wait for hours in ED, the problems continue.
Well, there's still a lot of pressure on the mental health system in the hospital, yes.
Now, the Northern Territory and federal governments are jointly investing $43 million in keeping people with mental illnesses in specialist hands and out of emergency departments.
This funding today is about focusing on that, what we term the missing middle, people that are not acutely unwell but could quickly become so, and providing support services to them.
Following them up after an episode in hospital in a much more active way will be a priority.
The federal government will contribute $30 million while the NT chips in $13. Broken down, the money includes more than $9 million for a children's mental health hub, nearly $6 million in funding for Headspace, more than $9 million on aftercare services for people who survived crises or suicide attempts, and more than $15 million to open 2 new subacute mental health care clinics and continue funding the one that opened in Casuarina earlier this year. Where exactly those clinics are built will be determined by a consultation process. There's also no specific timeline on when they'll be built, but advocates hope it's as soon as possible. It's also hoped the money will flow to Indigenous communities where suicide rates are often high, but service delivery challenging.
Certainly remote and rural mental health is in desperate need of more attention, but it's very difficult with that amount of money.
The new funding follows earlier multi-million-dollar investments in mental health, all in a bid to reduce the Territory's tragically high rates of suicide. Jesse Thompson, ABC News.